Hello everybody, I am Dr. Gaganpreet Kaur, consultant gynecologist at ARHI Hospital in Jorabat. Today let us know something about dysmenorrhea or menstrual pain. So dysmenorrhea or menstrual pain is the most common menstrual symptom experienced by 50 to 90% of young girls and women. It can be primary dysmenorrhea or a secondary dysmenorrhea. In primary dysmenorrhea, there is no reason behind the pelvic pain, and in secondary dysmenorrhea, we have a pelvic pathology like endometriosis, pelvic inflammatory disease and pelvic adhesion. So what causes the pain in primary dysmenorrhea? This happens because the uterus has to shed its lining during menstruation, so there is production of inflammatory markers. These markers cause increased uterine contractility and decrease the pain threshold also. These markers are also, inflammatory markers are also the reason behind nausea, vomiting, diarrhea, headache, muscle cramps, anxiety and depression that girls experience during menses. So how do we approach this problem? So this is approached by first differentiating whether it's a primary dysmenorrhea or a secondary dysmenorrhea. So in primary dysmenorrhea, this pain during menses will not be during initial 1 year of starting of menses, but in secondary dysmenorrhea, this pain during menses is going to be right from the time the girl has started menstruating. In primary dysmenorrhea, the intensity of the pain is roughly the same in each month, but in secondary dysmenorrhea, it is progressive and it worsens with every passing month. In primary dysmenorrhea, there is no bleeding disorder. The menses will not suddenly become heavy or irregular. But in secondary dysmenorrhea, the menses might become heavy or might turn irregular. Primary dysmenorrhea responds very well to painkillers, but secondary dysmenorrhea might need additional pharmaceutical or medicinal agents to help. So, painkillers are available over the counter to treat in dysmenorrhea. So why do we need a professional gynecologist here? We need a professional because the dose, intensity and the timing of painkiller makes all the difference. The dose is calculated as per the weight of the girl. The intensity and frequency has to be given to her depending on the symptoms and the severity of symptoms. Then the next thing is these painkillers are started 1 to 2 days prior to the onset of menses and should be continued 2 to 3 days into the menses. If one painkiller is not giving adequate response, we might have to change the composition of the painkiller. If this entire group of painkiller is not working, we might have to shift to hormonal agents. This automatically implies we have to rule out other causes by doing a pelvic examination or a pelvic ultrasound. So dysmenorrhea needs 3 important things. One is patient education. Second is parental support. Third is very individualized treatment regime. So girls, start speaking up for yourself because it is better than tolerating the pain. Thank you so much.